Hello, everybody. This is Brian Devine with Topline, and today I'm very happy to have with me Dr. Shelley Tretter, who practices in Cincinnati, Ohio, to talk about orthodontics and what makes her practice so special. So, first things first, welcome, Dr. Tretter.
Hi, Brian. How are you?
I'm terrific, thank you, and thanks for taking the time to speak with us today.
Thanks for coming in here and talking with me.
Absolutely. Let's jump right in. I think the first thing that I always like to start with is just tell us a little bit about yourself.
Well, I have been practicing orthodontics in Cincinnati for 25 years. I'm a mother of 2 children. I have a 12-year-old and a 10-year-old, and I'm married to a wonderful periodontist. And the other thing that I probably don't tell most people, unless you're a part of my practice, is we also breed golden retrievers. So we have a whole lot going on in our farm in northern Kentucky.
Oh, golden retrievers. How do you ever give up a golden retriever puppy?
When you have 10 or 12, you have to give some up.
Okay. That is great. That is great. All right. So let's say someone is watching this video. They're getting to meet you here for the first time. Can you tell us what you would suggest someone looks for in an orthodontist or in an orthodontic office when they're trying to choose?
Brian, I would say you want to look for a place where you feel comfortable. You want to feel welcome, you want to feel an individual, and you want to feel special. That is what our practice is all about. We pride ourselves on the fact that we treat every patient as an individual. We welcome patients into our practice. I think we always will. I hope we always will. And when you come into this practice, you are not part of a cattle call. You're not one of a million. You are one in a million for us. You're that special.
Fantastic. Now with that said, what would you say kind of makes your practice a little bit different?
I have wonderful staff. I have a small practice. This is not a practice where you come in and you look to your left and there's 10 people sitting in chairs, and you look to your right and there's another 10. When you come in and you meet Karen at the front desk and she invites you back, you know that you are an individual. She greets you by name. She respects your time. You come in, you do not sit and wait for a half an hour for an appointment. And so when you come in to see me and my staff, you're seeing the same faces every time. I sit down with each patient. It's not, oh, hey, Susie or whoever your name happens to be, because I can't remember because you're so new. Sit down with this patient and do what I told you to do last week. No, this is about each patient being an individual and being treated as special.
Yeah, and that's wonderful, because I think today people really want that experience. It's more than just having straight teeth. They really want that experience, and orthodontic treatment doesn't happen in a day.
No, it doesn't.
So
to have a relationship.
Yeah, exactly. Wonderful. Now let's get a little bit closer here. Why would you say someone should choose you? Now, we've talked about your staff, talked about the personalized, but why you? I know there's other options out there.
That's true. There are lots of options out there. What makes me special, what makes my practice special, is that we treat our patients as special. When you come in for your free examination, we greet you. You come back, you sit down, and if you don't have x-rays, we take those x-rays. We take photographs so that when we're doing our consultation with you, you are seeing your mouth, you're seeing your teeth or your child's teeth. And each time we do a head and neck exam, we do a thorough examination for the patient, and then we present the treatment that is proper, that will give you or your child the treatment that they need so that it works with who that child or who that patient is.
Wonderful. So what we're talking about is not just a free consultation, but a free orthodontic exam, where if you need x-rays, you're going to get them. If you need photos, you're going to get them. And that it's not just, hey, let's convince you to go to have braces here. It's, here's what's going on with your mouth, with your smile, with your teeth, with your face, and then finding out what kind of treatment is going to work best for you.
That's exactly it. And we do provide all of the treatment protocols that are available today. So if you have a teenager that is very active but not the world's greatest brusher, we could provide Invisalign Teen for your teenager. If you are a very busy adult and you travel around the world, you could use Invisalign, or you could perhaps use incognito, which is lingual braces, so they don't show. So yes, go ahead.
For those who don't know, lingual means on the inside of your teeth.
Correct. So they're completely hidden from the world. They don't know what's going on other than that your smile is changing and that things that the face that you present to the world is changing for the better.
Very cool.
We also, sorry, Brian, go ahead.
I was finished. I just think those are it's amazing what we can do today.
Yes, our options are considerable. We also do, of course, interceptive treatment for the younger children who have skeletal needs that should be addressed, and of course traditional braces. So we have aesthetic and metal braces for the traditional needs of the traditional treatment plan for a patient.
Oh, fantastic. I think that is the perfect place for us to end. For those of you that are watching, give the office a call, 513-697-9999. Take advantage of that free exam. And remember, it's free because it should be. You need to learn about what the treatment's all about, how it's going to work. You get to meet the doctor, meet the team, and really get a feel for what this experience is going to be like. So give them a call at 513-697-9999 and take full advantage. And Dr. Tretter, thank you so much for taking the time with us today.
Thank you, Brian.
Absolutely.
I enjoyed it.
You bet. Bye for now, everyone.